Hey everyone, and welcome to my channel, Coco and GTV, where we talk about mind and body matters because both your mind and your body matters. Today's topic of discussion is unstable moods, and this is part two. We are talking about bipolar disorder. But before I get into bipolar disorder, I want to kind of like give you a object lesson, so you can kind of better understand some of the things that I was talking about when I was referring to the unstable moods and the causes of them. So this here is an orange. And when you squeeze said orange, what do you get? You get orange juice. And so when you have somebody with a personality disorder, this person could be an orange. They were grown and cultivated to become this thing. And then when a certain amount of pressure comes, you get a particular flavor from them. That could be a personality thing, right? But an actual kind of disorder, kind of like PTSD, is a little different, because PTSD will come, you have a sour situation that comes into your life, in addition to who you are, makes you friable and more easy to emote and these flavors to come out, right? So then even a small amount of pressure, you'll get who you are and this extra thing. And this extra thing is gonna be like the irritability, the hyperarousal, all the things that I discussed in that first video with PTSD. Okay, same, right? Now, bipolar disorder is something altogether different. It's kind of like you are an orange and then all of a sudden you become fruit punch. You get fruit punch out of there. And so let me explain that a little bit better. Bipolar disorder is a common mood problem. It is a mood disorder that goes two ways. Bi, which means two, polar. So you could either be really, really, really high or really, 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 really low. Because a unipolar depression, major depressive disorder, is just one way. You're just feeling bad, feeling down, feeling sad. Bipolar, remember, you can go two ways. You could be manic-y high, where you are not sleeping, you are wanting to be president, your thoughts are like, oh, I'm so great, I'm the Queen of England. Could be spending a lot of money, doing impulsive things, dangerous things, drugs, prostitutes, all sorts of crazy things in that high mood. And that's unsafe, or then severely depressed. And this is not even like a regular, like a major depressive disorder. Bipolar depression, you can get really, really, really low. And so what we do in treatment is try to help and give you a mood stabilizer. We don't give people with bipolar disorder just an antidepressant because they have the propensity to go really high, right? And we're not going to give them something to keep them down. We need to give them a mood stabilizer. This makes sense to me because I explain this to my patient. I don't know how right this is, but I say that bipolar disorder is like an emotional seizure, and which makes sense to me because some of the mood stabilizing medication are anti-seizure medications, anti-epileptics. So I quickly mentioned some of those characteristics of the bipolar disorder. And the reason why I'm not spending much time on this one is because with the bipolar disorder, people are so low or so high that they usually come to clinical attention, meaning they present to a hospital, because if somebody's up for 3 days in a row, rearranging furniture, spending all the money, no more money, $10,000 spent in 2 days. I mean, family members, friends, people notice this and they usually come to clinical attention. So this kind of isn't like maybe I don't know where my orange went, but this isn't like the mood, the personality disorder, where this is kind of who the person is and it changes from minute to minute. It's hot and cold. I talked to her this morning, she was great. And I talked to her by the end of the night, and now the mood like switched like that. Now in bipolarity, yeah, that's better. In bipolarity, the mood changes don't go from minute to minute, the mood will be persistently high. It could last for weeks if untreated, or persistently low could last for weeks if untreated. It's not that, you know, I'm cool, I'm chilling, and all of a sudden it's like somebody is trying to cut somebody. Okay, so one of the books that I recommend to my patients and their families to read after being diagnosed with bipolar disorder is, I'm going to list it right here. This is an excellent book, The Unquiet Mind. This is from a clinician who suffered from bipolar disorder, and she explains it very, very well. I really like the psychoeducation piece of this, because patients kind of come away after listening to a memoir and they're just like, wow, this is me. I understand, it has a name. I can get better. And so it's really empowering. Somebody who does have bipolar disorder should have a psychiatrist. So this is not one of those things when it's like you can just lay on the couch and talk about things, or, you know, do some goal-oriented therapy. You know, you actually need, there's a medical management of this. There's a medical piece, and this particular patient needs a psychiatrist. So if you have a family member that is struggling with bipolar disorder, I don't knock essential oils at all. I don't knock, you know, herbs and that kind of stuff. Don't knock it at all. But this is something that needs to be under the like auspices of a psychiatrist, because of the how unsafe things can get. Yeah. So if you have any questions, please feel free, comment below, send email, whatever. And please tune in to the next video, because next time I'm going to be talking about borderline personality disorder. Take care. God bless.